Today on the Dr. Steve Show, we'll help you sleep better, grill healthier, and get rid of past mistakes. Are you tired of tossing and turning every night? Help is on the way.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for watching today. Up front, I'm revisiting a topic that hits close to home for millions of you. Well, it certainly does for me. I'm talking about sleep problems. The numbers are just shocking. 1 out of 3 people have insomnia at some point in their lives, and it's estimated that some 70 million Americans suffer from a sleep disorder. Now, a few months ago, I discovered I'm one of them.
Sleep apnea afflicts more than 28 million Americans and can do far more worse than ruin a good night's sleep. The condition can lead to serious health consequences, ranging from car wrecks to cardiovascular issues. And according to a recent study in Spain, it could also increase your risk of cancer. I've been told that I snore, so instead of going to a sleep lab, I decided to try an at-home sleep kit to see if my snoring is more than just a nuisance. Dr. David Volpi from EO Sleep in Manhattan stopped by the studio to give me the results.
Unfortunately, the test shows that you do have mild sleep apnea.
Oh, wow.
Now, let me explain that to you a little bit. What the test has shown is that you stop breathing 15 times an hour.
Wow. For how long?
15 times for greater than 10 seconds.
A few months later, I reconnected with Dr. Volpi to explore my treatment options.
Okay, Dr. Volpi, so last time we spoke, you didn't have such a great news report for me. Just review my findings really quick. I know I was snoring.
Sure, yeah, you snored actually over 30% of the night you were snoring over 30 decibels.
Right,
which
pretty
is,
loud.
It's pretty loud. It's
right.
pretty loud. So your wife is justified in being mad at you some of these nights.
All right, and the sleep apnea, how bad was that?
Basically what happened was you slowed your breathing down 15 times an hour, which is mild sleep apnea. So you're not getting the quality of sleep that you should be getting.
Okay, so there are non-surgical options and then there are minimally invasive options. Let's talk really quickly about some of the non-surgical options. One of the first ones.
There's basically 3 non-surgical options. Number 1, most people have heard of it. It's called CPAP, which is the mask that patients wear at nighttime. Very poorly tolerated, unfortunately, because it is a good treatment. Probably 2 in 10 people will use it.
Right, and that's the one. The problem is it's a mask and it has a big hose attached to it. And it blows air into you, and it's a machine by your bed.
Correct.
So there are other things. There's a dental device and something
Sure.
else.
The second option is something called an oral appliance, which is something professionally made for you that holds your jaw forward at nighttime. That's very effective. The third option is a new technology called ProVent, which is right there.
And this goes in your nose and your nostrils?
It goes under your nose.
Right.
It goes under your nose. There's a little, it looks like a little Band-Aid. And we could show you one of these real quick. They're right here. They're one-way valves. You wear it under your nose. You breathe in through your nose, out through your mouth. Also a little tough to wear, but effective for patients with moderate to severe apnea.
All right. So what are my minimally invasive options?
There's really 3 good minimally invasive procedures. Number 1, which is probably the most effective, is something called the pillar implant. And I'm going to show you this. This is a little device that implants a small... Let me just pull this out. We'll put this in your hand so you can see how big it is. But if you look at it, it comes out. That's how big the device is.
So this basically goes in my soft palate.
It's inserted underneath the mucosa into the muscle layer of your soft palate. And we typically put 3 to 5 of these into the soft palate. You can see it's about the diameter of a dime.
Okay, but what if I don't like the idea of having something implanted? There's another option.
There's another alternative. What we use is a radio frequency generator. It's called a Ceylon procedure, and it's basically the same result where we put a little device into the soft palate. It heats up the submucosal layer and forms scar tissue. And that scar tissue then tightens and stiffens the palate, similar to the implant.
Okay,
except
so
nothing is implanted.
Nothing's implanted. Downtime?
Couple hours.
Couple hours. That's very attractive. But my problem is that my palate is too long, right?
Correct.
My uvula is too long.
Correct.
So stiffening it may not do the trick.
So typically in somebody like yourself, what we do is stiffen the upper palate and then shorten the lower palate with a laser in the office.
All right, so that means you got to cut the tissue.
Well, it's really more vaporizing the tissue.
Vaporizing.
Vaporizing the tissue.
Vaporizing sounds so much more appealing.
And
okay, so what's the
downtime? The downtime is a little bit more because there's some pain afterwards, and that's typically 6-7 days worth of discomfort.
All right, I'm going to have to give a little thought to that one, but I think since the laser and vaporization is my option, we'll give it a little time.
Okay.
Thanks so much. I appreciate it.
My pleasure. My pleasure.
Well, I've decided to undergo the procedure Dr. Volpi recommended, so I'll keep you posted on what happens next.